I am delighted now to get us ready for our next speaker. One of the things that we work really hard at Echo Autism Communities to do is to think broadly about all the different perspectives that walk alongside and are part of the autistic community. And so certainly you've gotten a chance to hear this morning all about intense behavior. Then you've had a chance to hear Lindsay talk to us about thinking about supports and all of the different beautiful ways that a Japanese garden helps us think through that. And then you just got to hear one of our two listen to this Spectrum panels all about that autistic clinician experience. So autistic clinicians and how they see the world and their personal journeys, as well as their professional journeys. But this next speaker is going to share with us some really important information about practical strategies that can be used at home and at school. And we're going to explore common behavioral challenges and introduce evidence-based approaches to address them effectively. We'll also highlight the benefits of collaboration between parents, educators, and professionals to create a cohesive behavior supports plan. And so Jennifer Delaporte is a friend, and we've known each other for a long time. And I've also learned many things from her. She's going to help us to better understand navigating behavior, effective approaches for home and school settings. We do, again, try to give you all, those of you who are listening, either live or who listen to the recordings after the fact, a lot of opportunities to think about both the nuts and bolts, the practicalities of day-to-day support strategies and things like that, as well as those bigger concepts that help us to challenge our misconceptions, to help us really reduce stigma and challenge the kind of, sadly, the biases that have been developed over many, many, many decades related to autism and more broadly disabilities. And so certainly I hope that you're finding things that are useful to you as you're engaging with us today. But I am interested and excited to be able to share Jennifer Delaporte's expertise with you. And so without further ado, I will turn it over to her and we will get started. So Jennifer, we're ready for you.
All right, friends. So, as Axel said, my name is Jennifer Delaporte, and I am a behavior analyst, also a previous high school teacher, special ed teacher, and I'm currently now the transition coordinator for Columbia Public Schools. And my job now is I coordinate the work programs for students so that they can gain employment experience before they transition from high school. But we're going to be, I'm behavior analyst. I'm a teacher at heart as well. And so we're going to talk about behavior, and hopefully I can give some common strategies, evidence-based practices of managing and supporting behavior. I love the panel that was before me, because again, we're not, the goal is not that the person doesn't engage in any behavior and is looking, appears to be masking or like their neurotypical peers. The goal is to modify the environment so we can provide support for individuals. So let's talk through what that looks like, and I'll give you guys some examples and things that I've tried. We'll talk about what behavior is, understanding behavior. We'll talk about some proactive strategies, and then also some responsive strategies as well. And then there'll be time at the end for you all to ask questions. And I can talk about behavior. I can talk about autism. I can talk about all the things all the time for however long you need me to. And so, ask your questions. Hopefully we have time to do that. And so I went pretty broad on the topic of behavior. Again, it is one of my intense interests, but hopefully I say something that is helpful to you all that are here. So when we're talking about behavior, what is it? What is behavior and what isn't behavior? Everybody engages in behavior, regardless of if you're on the spectrum or not. And so just having an understanding of that and allowing grace for people to engage and interact with the world how they see fit. But these are actions that are observed. All behavior has a consequence, regardless of if you're on the spectrum or not. There's just certain things that we can't do in certain places. I can't yell fire in the library. that's going to have a consequence. Behavior has consequences. And so behavior is a response to the environment. It is functional. It serves a purpose. And we can change behavior. Now, identify which behaviors you would like to change. That's up to, the individual, the clinician, the family. And so again, when Joy was talking about teaching individuals to play, like, that's if I'm going to rip paper, again, rip the paper. But when we're identifying some of those maladaptive behaviors, the behaviors that impede learning or impede our interaction with our environment, then we can talk about what does it look like to change those behaviors. Behavior is not a good or bad label, or they're just bad. They're just stubborn. They're just, that doesn't allow any room for improvement. And so we'll talk about again, like what behavior is not. Is not just someone acting out for no reason. There is a function behind behavior. The consequences that follow the behavior allow you to better support behavior and either reinforce that or decrease it. And it's not something to just fix without understanding. We're not just trying to teach compliance. We're trying to teach skills. And we're going to work on building those skills. And so that's a main part of the conversation is how do we put supports and things in place so that we can build skills that we don't currently have. And I'm saying we as part of the conversation, because I think this takes a collaborative effort. Again, I am been at, in a clinic setting, school setting, and we have to figure out ways so we can communicate with each other so that everybody is on the same page. So with, okay, oh, sorry. There's a lot of things going on. Okay, so let's talk about the functions of behavior. So I also want to caveat that I know my slides were shared and some of you may have been great and printed those off, and kudos to you. However, my brain works a little bit differently and I get a little nervous about the content I'm going to present on. And so I changed things, and the last change I made was like 5 minutes ago. So we will get you the updated slides if you need them. So that's just a little caveat on how my brain works. So functions of behavior. We have Dr. Siegel talked about it previously. There's 4 functions of behavior when we're talking about it from a ABA lens. There's attention to a function, like I'm going to engage in this behavior so I get access to attention. That can be attention from parent, from peers, from siblings, and then escape, again, just trying to avoid or escape an activity or a task. To gain access to something, or an ABA, they say tangible, but just access to the iPad is typically what we see. And when that access is removed from the iPad, then you see some maladaptive behaviors of, hitting, kicking, screaming, those types of things. So we're trying to gain access to that. And then automatic or sensory, just something that there is some sensory input involved in when I engage in this behavior. So I talk with my hands. I like to fidget. I do have ADHD and I fidget with my hands a lot. And so that is reinforcing to me. And so figuring out ways that I can fidget and I'm not distracting to other people. Again, that's just a function of that behavior and it helps calm me down. And so we'll talk about some different ways to address some of the automatic functions or sensory functions of behavior. And again, like once, if these behaviors, maladaptive behaviors cross over into like if there's sensory input in biting or self-injurious behaviors, like how do we change that behavior and create, you can teach replacement behaviors by matching the function. So engaging in a function that has the same, you engage in a behavior that has the same function, but is more expected in certain environments. So next we're going to talk about the ABCs of behavior, antecedent behavior consequence. Again, I went more broad, and at the end, you guys have questions, we can talk more about specific examples, but in understanding behavior, we have to understand the ABCs. The antecedent is what happens before the behavior occurs, the behavior itself, and then the consequence that follows, which is a key component of this framework, I guess, or understanding of behavior. And so there's some examples there, but again, when we're talking about the antecedent of a behavior, it sets the stage. What happened right before the behavior occurred sets the stage for behavior. And then if we can identify the antecedent, we can intervene sooner in the hopes of preventing challenging behavior, modifying the environment so that we can negate some of that behavior at that early phase. And so understanding the antecedent is really important when we're talking about how do we change behavior. The B of the ABCs is the behavior itself. What does the person do? What does that look like? And so some examples, student is given a sheet of paper to complete their math assignment, and the student crumbles up the worksheet and refuses to do work. So that is the behavior. That is actually what happened after, not like the student felt sad, the student was just being stubborn or lazy. Like, what did the behavior look like? And you're describing that, and we'll talk about collecting data on that in just a second. But if you understand the behavior and why the behavior is occurring, again, you can teach those replacement behaviors, and that is key when we talk about changing behavior and creating skills. So the C is a consequence. This is huge. So not that, we're trying to rank anything, but the consequence, what immediately follows the behavior is so, so important to changing that behavior. Because if we're reinforcing it, in which we are going to reinforce behaviors that we want to increase, the reinforcement allows the behavior to increase. So it determines whether the behavior is going to happen again in the future. So consequences can be positive or negative. And we are going to obviously always try and start with positive reinforcement and identifying reinforcers, and what, reinforcement can look a lot of different ways. A lot of times, people are like, you feed my kid all day, with goldfish and things like that. But if food is motivating for them, is a reinforcement for them, then we can use those things to increase the behavior. Some people are really reinforced by a high five. I've had students who would run a mile for a high five. And so just identifying what that reinforcer is and make sure that we're pairing it with the appropriate behavior or expected behavior really helps us when we're trying to think through how do we change behavior. And again, on most slides, I have a classroom at home example because, again, we're talking about like what do these things look like both at school and at home, and making the connection between both. So when we talk about, again, the ABCs, here's some examples. So in the antecedent, the teacher handed an assignment. The behavior was the student shouts, "I don't want to do this." And then the consequence was the teacher sends the student to the hallway. So unintentionally, or maybe intentionally, because again, I understand, like as a parent, as a educator, sometimes kids will take you there. And you're like, whatever, just go, just do. Yep, you want 5 more minutes. Like, understand that there's a lot of things that are happening in life. Things don't happen in a vacuum. And so sometimes you reinforce negative behavior. As long as it's not the norm, give yourself some grace. But so the teacher sending the student out in the hallway, if the function of that behavior was escape or avoidance, now we have reinforced that escape and avoidance behavior. So the next time that the student is trying to escape or avoid, they're going to shout, "I don't want to do this." Or they may shout, "This is stupid." Or they may shout something else. Or they may throw the paper. They may crumble it up. And so we just have to be mindful. Like, once we understand why the behavior is occurring, then we can teach the replacement behavior for that. And we'll talk about strategies for that in just a little bit. Again, parent, it's like, parent says bedtime in 5 minutes. So that was the antecedent. The child throws a tantrum, and then the parent allows 10 more minutes. Unintentionally or intentionally, we have reinforced that when you tell me it's time to go from my screen to bed, and I throw a tantrum, I get extra time on my screen. So you've reinforced that behavior. And again, I get it as a parent. Sometimes it has been a day. And if you are quiet and you need 10 more minutes, it is okay to be able to reinforce that behavior. We just want to make sure that that's not a consistent thing. Okay? So the ABCs, data collection, you got to collect the data. Judge Judy said data or it didn't happen. Okay, so with ABC data collection, you can get as fancy as your heart desires. Sometimes in ABA, I'm like, this is very complex. And so in school settings, you don't always have that time to be, and even in clinic, you don't always have the time to be complex and to neatly write out or type out everything, and we're just checking boxes. Sometimes, you just need a pencil and paper. What happened first? What was the behavior? What was the consequence that followed? So these are two different examples of collecting ABC data. And then once you have, a few days of this, like we're not collecting ABC data on, again, identify the behavior that you're trying to change. We're not changing everything in one day. Pick one behavior for parents and for school. We can't do a drastic overhaul of behavior in one sitting. So choose a behavior, collect some data on that behavior, and then based on your ABC data, you can see patterns. I think one key component on that is the time of day that things are happening, because that tells us a lot. If it's always at 8:15 in the morning, we need to figure out what's happening at 8:15 in the morning. And then you can look at your data and tell, okay, so at 8:15, that's when we're switching from our, morning routine and circle time, and it's time to get into our content area work. And so that understanding that transition and that function of that behavior, if it's avoidance or escape, then we can start to modify the environment to better support that student. And again, it can be as complex or as simple as there's apps. There's an app for that somewhere, I'm sure, to be able to track data. But again, you can just get pencil and paper and write down antecedent behavior and the consequence, but make sure that you are collecting that time as well, because it can really provide some insight. So understanding behavior, I like to say, we talk about expected versus unexpected. Sometimes with individuals with autism, that nuance is difficult to understand. And so when you're using finite terms like appropriate or inappropriate, trying to teach that and teach that nuance, I've found that expected versus unexpected just allows for more flexibility in when teaching different behaviors. Context matters. Also, and there's a lot of things that go into context, just not the setting. But age matters. So not ageist, I'm just saying. So a person who is trying to, giving someone a hug, a person that a member of your family, a friend, that is totally fine. It is unexpected if you're in the grocery store and you're passing out hugs. Also, when I talk about the context and age matters, a 2-year-old trying to give me a hug at a grocery store is different from a 26-year-old trying to give me a hug at a grocery store. And so we have to be able, again, these students grow up, children grow up. We have to teach these skills and these behaviors. And when I think about it, a safety component of that, getting into someone's personal space at 4, when a kid just climbs into your lap during a session, or, at school, they're, trying to sit really, really close to you, versus, and when I'm teaching students on an employment site, getting into someone's personal space and not, male or female, non-binary, all, getting too close to someone and their lived experiences, people take that in different contexts and ways. And so we have to be able to use the language of, okay, that's expected or that is unexpected. And using that same language across environments. So at home, use it unexpected and expected. And at school, they're hearing unexpected and expected. I think it helps with the um, again, establishing expectations for across environments. So again, inviting friends to your home. We had an individual that would do that. And so, at first, oh, that's, nice. Like, you want me to come over, and, understanding what is a friend. We're talking, so we're friends. So then I can invite you over. Again, that's a safety concern. And so, just being mindful of like what is cute and acceptable now as individuals grow up. And that's something that I'm running into as I work with high school students and finding employment, is, the behavior is unexpected in the workplace. And we have to teach that as students gain more and more skills. All right, so let's talk about some proactive strategies that we can use to better support individuals. And I know the focus is on autism, but everybody engages in behavior, everyone. And so the behavior strategies are behavior strategies for individuals with autism or intellectual disabilities, ADHD. These things are, again, about behavior and not necessarily the diagnosis, or yeah, not necessarily the diagnosis or lack thereof. Some things that I'm going to talk about just here in a second are helpful for me. And so again, behavior is universal. So we're going to build in predictability and structure. We're going to build in those routines. Again, as someone with ADHD, routines are key for me, so that I don't get overwhelmed. And so we're going to try to build those in and make sure that we can structure the environment in a way that is supportive of the individual. And so you guys have heard, and I have some examples of like visual supports, but we're also going to have like clear expectations. If it's circle time, what is the expectation of circle time? What does that look like? And then how do we add things into the environment so we can better support that? What kind of signals can we provide students to help them understand what the expectation is? And then if we're going to, try to change the behavior, again, a student is not sitting in the circle. Again, that might not be a behavior that we're going to address, but if the student is hitting others while sitting at circle time, that is something that we need to discuss and try to change. Social narratives or social stories to explain a common situation, so there's some familiarity around it, like going to the grocery store. Okay, we're gonna go, the social story would explain like this is something that you can expect. The same goes with employment, of explaining, okay, on this job site, these are the expectations, these are the tasks you're gonna do. It outlines all of those things. If a student really needs those visual supports, add in some visuals. If a student needs that read to them, or whatever it is, again, you're going to individualize these strategies to match the student or your child that you're working with. But social stories and role play, if the student or person has the language, receptive and expressive language ability to role play and go back and forth, discuss those things and build in, again, structure it as much as you can. Now, there's nuances, and there's going to be conversations that, go one way or go the other. And so, but having a strong foundation and base for a conversation can be helpful and take out some of that anxiety around navigating that. And then environmental modifications, flexible seating. So I've in the school setting, there's so many things from, wobble chairs and some things I don't even know the name of. I was like, oh, that's cool. That would have been nice when I was in school and fidgeting a lot. And so just being mindful and open to those things as well, but not being distracting to others. Because I also like there are other people within this space. You're not the only person in that space. And so how do you navigate that? By allowing space for yourself to be who you need to be and allowing space for others. So, two of the strategies that I'm going to talk about on the screen are the red and green card. And um, we'll talk about the bracelets as well. So with the red and green card, red signals that something is available and green signals that it is not. And so we've paired this, and I've used this myself with clients that I've worked with who, again, could not transition from the iPad. And so on red it was available, on green it was not. And so we taught the use of this of the red and green card, and on green, if the student asked for it or made a request that may be verbal, or they may give a signal that is reach for the iPad if that's what they wanted, we would say, good job asking, and then hand over the iPad. If it was on red, 1 to 2 times, we would say, it's not available, you're on red. One other time, again, like I said, 1 or 2. The second time it's on red, it's not available. And then we would ignore when that request was made. A green, get it every time you ask, in an expected manner, you get the iPad. The red and black wristbands were used for an individual we were teaching employment skills. And this individual was a little social butterfly and went around and talked to everyone. And talking to people is his favorite pastime. And so we had to differentiate and add to the environment. What is a signal to signal to him and to the others that he's working with, his coworkers, that either he was working or it was time for him to have his free time. And so red meant that he was working. And if he was on red, he was working, and any coworkers that were with him, they knew to redirect him and like, you're on red, it's time to work. And then on black, he had his free time, and there were certain things he could do while he was on his break, so to speak. Again, these methods that I'm sharing, you're going to have to teach this. It is not, I didn't just hand my client a red and green card and was like, on red, you can't get the iPad. On green, you can. And then boom, it's a magic wand, and like, oh yeah, that's what that means. Like there's a process to it. There's a fading process. There's communication around that with the family. And so there's a lot that go into like these behavior strategies. But with the red and green, what I learned, or red and blue, or red and black, what I learned is like also teaching the coworkers was a huge thing, because if I am reinforcing, so if he, he's talking, so let's say he has an attention function. With his attention function, if I am reinforcing his attention while he's on red by talking to him and showing him things, then it has lost its effect, because the red is signaling that he should be working. And so teaching coworkers, teaching the peers, like what the expectation is, and what the purpose of while we're changing behavior is also important. And then, he did get sneaky sometimes, that he would hide his wristband or he would switch to black when he's not supposed to. And so again, this is not a behavior, everybody engages in behavior, and there's nuances and there's things that happen. And so you just have to be able to problem solve when those things arise. So visual supports, again, just help break down tasks. I really appreciated when Joy was talking about, like, when we're modifying tasks, give me the tools to complete the task like everyone else. Yes, so when we have a task analysis, like, this is your tool that you can use, and eventually we're going to fade that tool. Or if you still need it, that's totally fine. Like, we'll just figure out a plan for you, again, to fade it gradually. But teach to use the tool instead of just relying on that reinforcement or support from like the therapist or job coach or the parent. So here we also have some periodic check-ins. So after this patient was learning to clean rooms, so after 3 times, he was to ask someone to watch him clean a room, and then they collected data on that, just like to make sure that he was doing it correctly. And so we have some built-in supports within the tool itself, but also allowing him to be independent. There's also vacuuming, just like task analysis with pictures on like what you're supposed to do. Again, trying to build that independence. The gold example there is like having a conversation. It was working with a client, and we were trying to determine, we had to determine the components of a conversation. We talked about, what a conversation looks like. We did some role playing, and then this was self-monitoring. So after we had a conversation, he would go through and put yes or no if he did those things throughout the conversation. And then there was another data sheet with it where I would see if I agreed with him or not. But again, teaching the skill, this is not a skill that a person has yet. And so how do we teach this skill in a way that the person can be successful, engage in the behavior without a lot of supports and build independence? So another thing, we spend a lot of time on that one, but modifying the antecedent. So again, trying to prevent behaviors before they occur. So given choices, in this and they don't really do homework anymore, although my daughter brings home some homework because she's a little bit of a perfectionist. But given a choice, the first step in self-advocacy is making a choice for yourself and what you want to do. And so do you want to start with math or reading? A warning for, the TV, or even a choice for the TV, like, or a tablet. You already know that as a parent, they can have 10 more minutes. You can say, do you want to have 5 more minutes on the tablet or 10 more minutes? They thinking, oh, I'm doing 10 more minutes. Mom's gonna give me 10 more minutes, but you've already built that into your schedule. You understand that you have 10 minutes. They may not always be privy to that information, but providing a choice, allowing someone to choose what they would like to do is huge for self-advocacy, and also just being a human being and having choices over what you do with your body. Provide a warning. So, okay, 5 more minutes, and then we're going to turn off the TV. Instead of like immediately, okay, time to get off right now, providing that little bit of a grace period. You can set a timer so that they understand when it is time to transition away from the screen. Adjusting the environment or teaching like, okay, when I get overwhelmed or overstimulated, the lights are too bright or there's too much noise going on, instead of engaging in that maladaptive behavior, I can ask for my headphones. I can ask to leave that environment, things like that. And so establishing communication, enhanced communication is key when we're talking about behavior. How does a student ask for what they want? How does my child ask for what they want? And figuring out what works best for them. So there's PECS, like picture exchange. Now with technology, a lot of iPad apps and things like that, there are still the traditional AAC devices, or a talker, as people, call them sometimes. So a talker, and just again figuring out a way, like that is step one when we're talking about behavior, is how can we meet the needs and wants of the individual, and then teaching emotional regulation. And so again, that's something that I think sometimes we overlook when we're talking about behavior, but like teaching those skills, like this student just blows up on everything, about anything, is such a different view and mindset from, okay, they don't have this skill right now to regulate. And so how can I teach that skill? And what does that look like when I teach that skill? And how do I teach that skill in a manner that the student is understanding and again can use the tools that we provide effectively? build the skill. So, again, when we're talking about teacher replacement behaviors and building a skill, there is a skill deficit that we don't have just yet. So I can't clean my room all by myself just yet. I can't complete a 50 page or a 50 problem worksheet just yet. How do I how do we teach that in a way so that this person is engaging in expected behaviors within, the context of what they're doing. So if you look at it from that point, I think, I don't know, for me, it just gives me an avenue of way to navigate it versus it just being, this is one more thing that I have to deal with and one more behavior that we're going to have to navigate. So we're going to build the skill. We're going to figure out a way to teach it. And then whatever that way is, it should be across settings. So, if I'm going to teach you to, let's say we're working on adaptive skills. I'm going to teach you to put on your shirt. The way I teach you how to put on your shirt and the way that you're working on that at school, that should be the exact same way. Again, so the expectation, the routine is clear, and everybody is doing that across the board. So when you're teaching replacement behaviors, again, instead of yelling, we're going to teach the student to raise their hand. Instead of throwing a tantrum, we're going to teach the student to ask for 5 more minutes. But 5 more minutes might be too much. We may have to start, or maybe you do start with 5 minutes, and then we get it down to asking for 1 more minute. Again, all of these behaviors and strategies have levels and should be individualized to the person. If a student can, ask for 1 more minute, and you are able to provide that, again, if you're going to teach that skill to ask for 1 more minute, then be able to reinforce that, because that consequence that follows the behavior, again, is the huge piece and component of changing or maintaining behavior. And we already talked a little bit about, instead of hitting or throwing things, teaching a child to request a quiet space if they are overwhelmed. Okay. So here's some responsive strategies. So we've tried to intervene at the antecedent level. We put some strategies in place. We've modified the environment. Here are some additional strategies, like when the student is engaging in behavior, or some things to think about after the behavior has occurred. Number one, I know I keep saying number one, but there's a lot of different, even though this is more general, I want you to understand consequences because that is key. But this is also a key component when you're responding to behavior. Try to stay calm and regulate yourself first. So many times when I'm doing classroom observations or, at home working with, students, working with my own kids, like if you are dysregulated, you cannot help regulate someone else. And it is hard. It is difficult. Kids will take you there. And if you don't know where there is, consider yourself lucky, but they will take you there and you will be bad about it. And so just again, sometimes things happen and you can't control it and you reinforce the negative behavior. I have been there, done that. Just again, as long as it's not your go-to strategy, but at all possible, try to stay calm, neutral, a neutral tone of voice to help someone regulate while they are dysregulated. And then you're going to try to match that response. We're teaching a replacement behavior. We understand the function of the behavior. So we're going to try to teach a behavior that serves the same function so they get that positive reinforcement by engaging in the expected behavior. So if it's an attention function, planned ignoring is again, it's a strategy. It is evidence-based strategy, but sometimes you can't ignore certain situations if there's safety involved. But if a student, let's say we're at home and my kid wants a snack and they're yelling at me, Mom, 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 I want a snack, I want a snack, I want a snack, I want a snack. Planned ignoring, key, because we're going to remove the attention. And then once they ask in an expected manner, then they get access to the snack. So I can say, you can ask, And then once they ask, then I reinforce that behavior. So planned ignoring is like if there's an attention function, you're going to try to remove the attention until the desired behavior occurs, and then you can provide attention for that. Escape or to avoid, a strategy is we're going to try to modify the task. So if we're going to, if a student is crumbling up the paper and we've identified the function, okay, they're trying to escape the task, we have to build up their tolerance for that task. And so instead of the 50 question math worksheet, maybe it's a 5-question worksheet, or it is, there's a red line across it. We made it visual. I want you to work into this red line. When that red line is done, you can take a break. So like using first, then. First, we're going to do this, then we're going to do that. And it can be, again, based on language level, it can be as complex as you want it to be at first then, or it can be as simple as you want it to be. It all range levels of, pictures and things to activities. So we're going to try to modify that task and break it down into smaller chunks. And again, or, we're going to teach the student to appropriately ask or expectedly ask for a break. Now breaks are not always possible. So teaching tolerance and how to break the bigger task into smaller pieces may be a strategy that we're working on as well. To gain access, we're going to, again, I know we talk about appropriately and inappropriate. And so, but how do we request that access instead of grabbing it from someone's hand, screaming someone to give it to me right now? How do we make sure that that student is gaining access in an appropriate manner? And so we're going to teach them to request that item appropriately. And then again, I talked about it, like how do I get my sensory input and be mindful of other people? And we can, talk through and discuss different strategies for what that looks like. Consequences, we talked about it, and adjusting the consequence so that we're reinforcing that positive behavior. So again, providing, a student completes the work, providing a reward or a break after they finish, especially if you know that was really difficult. That was a really difficult task. They engage in the expected behavior. They use their tools and strategies so they can complete it independently. Providing a break and a reward for that is great, and it reinforces that behavior. And the next time there's a hard challenge or a hard worksheet, they understand that, okay, if I'm working, then this is what if I engage in the behaviors appropriately, this is what I get in return. Again, I do these same behavior strategies. They're not, my students or my kids are not on the autism spectrum, but at home. So we have this is you might not be able to see it. This is our marble jar. If they are doing the things that they're supposed to do, we've talked about expectations, we've talked about chores. Again, I've taught all of these things, not A1 parent. I'm a better BCBA at home. I'm a better BCBA at school than I am at home. But this is their marble jar. I don't take marbles away from them. Once they've earned them, they've earned them. But this jar, they want to have a sleepover downstairs where we watch movies. And so that's free. It doesn't have to always be this elaborate thing. Just figure out what the reinforcement is and then use that to reinforce the behavior that you want to see. So I'm running a little bit out of time, so I'm going to maybe go through these a little bit quicker. But essentially, we're talking about effective consequences. I'm going to talk about reinforcement versus bribery. And again, I'm not above bribery. I'm just saying it should not be your go-to strategy. But we'll talk about those things and then just try to, avoid overuse of like inconsistent follow through. If you say like, do first this, then this, and the student or your child engages in some behavior, maladaptive behavior, and you're like, okay, it's okay. Like you've reinforced them engaging in that behavior. And so the next time that is exactly what they're going to do. So if you say something, follow through with that consequence. Again, this talks a little bit about reinforcement and just the key components of like it's given after the behavior. It encourages like building that skill and being able to be independent, and it creates long-term behavior changes versus bribery is given before. So if you just sit here for 5 minutes, give me 5 minutes, then you can have some ice cream. It's very different from okay, first we're going to do our homework and then you can have ice cream. It encourage it says manipulation, but like, if I do this, if I engage in this problem behavior, this maladaptive behavior, this is what I get. And it creates short-term compliance. And so again, just figuring out what the reinforcement is. Everybody's reinforced by something. It doesn't always have to be something expensive. And so just figuring out what that looks like and then being able to adapt that to your child or student. Just more examples on that. So like if you stop complaining, I'll give you candy, versus reinforcement. Once you finish your homework, you can have extra playtime. And again, it's just a different set of, it's a different mindset. But I just want to be very clear, I'm not above bribery just all the time, not all the time. Okay. De-escalation techniques, understanding, recognizing when the student is distressed, providing safe spaces or breaks. I really like the co-regulation before expecting self-regulation. Teach the skill, teach how to breathe, teach where to go, teach the expectations of the environment, and then be there and model those things with the student or with your child before you expect them to just go and do. You should know how to calm down. You should know how to do this. Teach the skill, go with them, breathe with them. In school setting, I know you have, a classroom of 20, 25 students. It doesn't have to be like one student that you're teaching this to. Teach the class, teach the classroom expectations and what that looks like. Breathe together, do movement together. And yeah, that's just some de-escalation techniques. And then collaborative problem solving, including the student in their planning. When we're talking about behavior, the student should be included in that, having understand, if they're able, cognitively, verbally, we want to include them as much as possible. And that goes into like the IEP as well, and making sure we include students in that process. And then teaching the replacement behaviors that we talked about. So this slide talks about replacement versus compliance. And again, it's just a different way of viewing things. And there's a few examples that you guys can, look at. I'm trying to make sure we get through all of our things. And there's like 2 more slides.
Yep, you're good.
Again, so communication between parents and educators, clear and consistent expectations, and then involving individuals in their support plan, and their behavior support plan. So there's some key takeaways and things, but hopefully you guys got all the things and you can ask me some questions.
I love it. Jennifer, you did amazing. That was so helpful. And I think really, really a whirlwind tour, but a fabulous whirlwind tour
Yeah.
to help us with those practical strategies. That was great. Thank you so much. I do have a couple of good, really great questions that have come in that I want to make sure we have a couple of minutes for. So one of them is related to elopement, so runners, if you will. What strategies have you found to be effective for kids that either are at risk for elopement or who are active elopers or runners, depending on what phrase you want to use?
Yeah. So
Tricky one.
again, how can we modify? I don't, elopement is difficult. How can we modify the environment to help and support students who elope? So that there's a lot of different strategies in staying close to students. I know like sometimes at the playground you're like, there's no way that I can keep up with this student. Let me think. With elopement, it's been, again, teaching when we can run and when we can go and explore and do all the things. and when we can't. Sometimes if a student doesn't necessarily understand that, just like proximity, um, and if you know a student is going every time it's time to come in for recess, that student is going to take off running. We're not going to announce that it's time to be done with recess until we're very close to that student and we've grabbed that student's hand. And then we announce, okay, recess is over, and you already have a hold of that student. So with the low mid, it's difficult. With parents, there's alarms and different things to signal when a child has left the space. Um, and again, what is the function of the behavior? That's a difficult one to um, problem solve and think through. But if we again, like where's a safe place to run and be and elope and be your grand self and figure out, how do we teach when we can and when we can't engage in certain behaviors, if that makes sense.
It totally makes sense. I agree. I'm
Yeah.
a big fan of helping kids know what they can do,
Yeah.
and reinforcing that. And so I think that's awesome. Okay, so
Right.
another question, and I think this is an interesting one, and one that I know I struggle with sometimes with my patients and their families. So with parental involvement, what if it's incredibly difficult for the parent to regulate, but the parent wants you to work with the child on regulating? What would you recommend for the child, and kind of helping? Again, it's that tricky situation, like
Yeah.
co-regulation. We all know how important co-regulation is, and for the grown-up to regulate in order for the child to then learn to regulate. So
Mhm.
what have you found effective, or what are some strategies that you've used in those tricky situations, which I know I find myself in a lot as well?
Yeah. So, mm, I think with the co-regulation piece, again, just teaching, as a parent, like as an adult, we have identified our triggers, we've identified what things are just like not acceptable, and things that we struggle with. And so being mindful of those things, and creating a plan. Like, what is the plan? When your student or your child engages in this behavior, what is the plan? So it's not in the moment response. We have a plan, we have a script, we know exactly what to say. That's been helpful of teaching, families, like even like a flow chart, like, just a visual of something like, okay, I need to breathe. And again, going back to that tool instead of just reacting in the moment. Giving yourself a little bit of grace, like it is difficult. And you don't always respond to behaviors in the best way. And just allowing space for that and, being able to give yourself some grace in like when you respond. But I think the biggest thing is like if it's really difficult in the moment, or practicing those things when everyone is not heightened. Because if I'm in the middle of being frustrated and someone left dishes in the sink, and my husband goes, just calm down, oh, I'm gonna be on the news. So practicing those things, those regulation techniques when you're calm, is helpful. And then having a plan and sticking to the plan. So it's not a whole lot of brain power spent on what do I do. You already have the plan, read it, go through it, calm yourself down, regulate yourself, and then help your student or child.
I love it. And yes, I agree. I'll be right there on the news with you too. I have to work on self-regulation all the time. It's a
Yes.
skill that is still requiring lots of practice for me.
Yes. Yes.
So yeah, imagine, right? I'm a full-grown adult who theoretically is, doing well in life, but I work hard on practicing
Yes.
self-regulation, and frankly, it's a daily thing. So yes, I can
Hmm.
imagine, kiddos that need to learn those early skills, how hard that is for them, and especially if they don't have a lot of great modeling. So to me, what I
Right.
hear from what you're saying, and what I hope people who are listening here, is how important it is for any of the adults in their spaces, their teachers, their paras, their
Hmm.
whomever, the daycare individuals that are working with them. All of us can do a great job of trying to practice that self-regulation to co-regulate with kids as they're learning those important skills. So I think
Yes.
that's really, really helpful.
And
So
I
last
think too, like,
question. Good.
um, one thing I used to, tell teachers and paras is to quit taking it personal. Like behavior has a function. And so it's not a personal thing towards you. And so once we figure out that function, again allow yourself some grace, but like it is not a direct target at you when the student is not regulating themselves. And so I think taking that step back has also been really helpful for some teachers and paras, and like they're not, throwing things because of you. It's just, a function, and we got to figure out what that function is.
Yes, absolutely. Absolutely agree with that. And I think for parents, that's also a really important point too. Now, of course, it's possible that sometimes it is directed at the parent, but
Oh
in
yeah.
general, but in
Yeah, because you're that
general,
safe place. Yeah,
yeah,
yeah. Mhm.
yep, exactly. But in general, I think it's so important for us to really just see behavior as behavior and then work as best we can to adapt to it, understand it. And so you did a great job of helping us think through that.
Thank you.
Last question I want to get to is we have some individuals who work at a daycare facility and
Mhm.
wondering about basic resources, suggestions, or more general basic strategies for the staff, as they often have very little background on the kids that are coming to their programming, but have a large variety of disabilities. So again, just thinking like very basic information that might be a good place for them to start in thinking about behavior strategies for kids in their daycare.
Daycares are tricky. Yes. So I think again, communication with parents and understanding, talk with parents and like get in as much information as you can. And then, sometimes parents like they have never done this. And I'm like, and so I think again, with daycares, and with any, behavior strategy, what are some ways that would better support the student? So a lot of visuals and how you arrange the environment is huge. Again, teaching that skill of like, okay, when you feel like this, you can go here. I was in a daycare just a few days ago watching, one of my students who was an employee, and they had little songs that they sang about, when I feel sad, I can do, I don't know, it was pretty catchy.
Yeah.
And I was like, okay, I
Yep.
like this.
Uh-huh.
But yeah, just figuring out how do we again improve or increase independence. I know with littles it's difficult, but they do need to learn those strategies and skills. Talking with parents, I mean, they're not in school just yet, but observing, collect data on it, instead of just like how you feel this student is doing, do the ABC data collection. See when you're seeing, if you're seeing the behavior, what is the antecedent? What's the behavior? What was the consequence that followed? Look for those patterns in the data to help you, make your decisions and how do you move forward and better support kids.